You know, we've been following the cases very closely. Right about this time every morning on Good Morning Arizona, and an urgent alert just went out a short while ago from the Arizona Department of Health Services. A record number of cases, 2,519 to be exact, and 32 new deaths, with the rate of increased positive cases now at 9.1%. So we want to bring in Dr. Cara Christ joining us. We had 25 plus new cases today, more than 1,000 yesterday, close to 2,500 the day before. Is this alarming to you?
So we are concerned with the increasing numbers, which is why the governor put out new requirements yesterday to help slow and contain the spread of COVID-19.
Let me ask you, because a week ago, we saw those cases surging. 2 weeks prior to that, we saw the upward trend. Why now and make a stand now as opposed to a few weeks ago when we saw the trend?
So we're always watching the data, and we were starting to see upward trends in the number of cases. Then we started to see upward trends in the hospital metrics that the hospitals self-report. This week, we started to also see upward trends in our COVID-like illness syndromic surveillance. In addition to that, the CDC just came out with brand new data that shows not only do the masks protect others by preventing the transmission, but there's also a protective effect for the people wearing it. So it's really important that everyone wear a face mask when they're out in public.
I'm glad you bring this up, because there's so much misinformation out there and so many people who say masks don't work. But that's your number one request and push right now.
Yeah, in addition to physical distancing, because physical distancing, staying that 6 feet apart is really important, but the mask adds one more protection layer.
Let's talk about community transmission. How aggressive is this virus right now?
So this virus is very contagious, and one of the things about it is that you can be asymptomatic and spread it. So you can be spreading the disease without even knowing that you have it. That's why the face mask is so important. And a lot of people have just either no symptoms or very, very mild symptoms and are still able to go out into the community.
Doctor, I know you've been asked this time and time again, but did we open too soon?
So we didn't open too soon. We were squarely meeting the criteria for phase one. What we need everybody to do is take those steps to make sure that they're not transmitting it. We knew we would see increased cases. And in fact, I expect to continue to see increased cases for the next week or two, because it's going to take a while for these measures to impact our cases.
Governor Ducey says he's leaning on you very firmly and taking your information and then taking data and analyzing what they're going to do next. We opened up on the 29th, or you extended the stay-at-home orders on the 29th. 5 days later, they then changed course and said we'd start the reopening phase. What kind of data in those 5 days made you change course?
So we saw that there was a leveling off of the cases, and then we also know that there are impacts of stay-at-home orders that are detrimental to people's health as well. And so we want to make sure that we're giving everybody the opportunity to be able to work, to live healthy, but also take those precautions to prevent the spread.
By allowing the municipalities to decide on the face mask, is that a patchwork, and is it effective if, say, Mesa says yes, however, Gilbert or Chandler says no? That's assuming that people aren't going place to place or town to town.
So we know that there's a lot of traveling, especially with as close as like the Phoenix metropolitan area is. And so right now we do have areas of the state that aren't as impacted by COVID-19 as other areas. Maricopa County is one of those areas that is significantly impacted. So the governor was listening to the local leaders. They had specifically requested this. And so as we watch the data, we may make statewide recommendations. However, just because your city doesn't put it into effect doesn't mean that you can't wear one. We encourage everyone to wear one regardless of the requirements.
I have to ask you about the hospital beds out there, because they're most important when we talk about COVID-19. We are at that critical level beyond 80%, statewide close to 83%. Should the hospitals enact their emergency plans, and does that mean getting rid of elective surgeries?
So we asked, every flu season, our hospitals have a surge plan, a plan that they can enact to make sure that there's staffing and resources and PPE. Back in March, we asked them to pull that up and start activating that plan. We have a lot of things in place, and while we're monitoring from a statewide level, There are hospitals that may be over that threshold, but have put other things into place to ensure that there's adequate capacity.
We thank you very much for being open and speaking with us. We know the public out there is very concerned about this, but once again, stressing the importance, social distancing, washing your hands, and especially wearing the face mask out there, guys.